Hi everybody, welcome to the NanoBeing. In NanoBeing, we are going to talk about the latest articles and news on the role of nanoparticles and nanobiomaterials in different fields, such as, for example, as a starting point, immunotherapy and phototherapy. As an introduction, why is immunomodulation important in the modern medicine? Immunomodulation offers a way to treat infectious disease. We know that infectious disease in humans occurs by different types of pathogenic microbial microorganisms such as fungi, bacteria, viruses, and recently several resistance mechanisms which enable the microbes and viruses to protect themselves against antibiotic drugs is arising. So this is a very bad condition, mostly for example for wound healing or like this. And this is very important if we can do something using immunomodulation to treat infectious disease. And the second one is cancer, that we're going to talk about more later. And third one, autoimmunity, is the immune system response towards its own healthy cells. So it can happen in the many organs and make many problems and disease such as rheumatoid arthritis or like this. And organ transplant tolerance, we know that is a state that is characterized by the lack of a destructive immune response in the recipient towards a well-functioning donor allograft. So it's very important for transplantation, and we are going to see how we can use biomaterials to do a better immunomodulation to treat this kind of disease. How do biomaterials contribute to immunotherapy medicine? Just as a starting point, by precise delivery of cues to immune cells. And the second, by directing immune responses to the timing, duration, magnitude of the antigen and inflammatory cues. So we can have a more precise delivery of cues or antigen to the immune cells. So this is very important. And the second, we can have more control over more control over the immune responses by controlling the amount of antigen, the duration, the timing, the release rate, or kinetics, or like this. If we want to classify the biomaterials in immunotherapy, mostly we use nanoparticles and hydrogel. There are many, maybe construct of the materials in immunotherapy, but we can classify at this moment to nanoparticles and hydrogels. We are going to talk about nanoparticles here. So the first question, what is a fundamental requirement for the nanoparticle-based vaccines? The answer is effective delivery of antigen and inflammatory cues to lymphoid organs. Most commonly, the lymph nodes that drain from a muscle or a skin injection site. So this is very important that we should know that the effective delivery of antigen and inflammatory cues to the lymphoid organs is our main target. This happens mostly, for example, by the cells like the dendritic cells that at first are immature, mostly, for example, those that are residing in the skin injection site. So they convert from immature state to the mature state, and they go to the lymphoid organs. So, and then they can affect the, for example, the ultimate goal that we are seeking for. What is the fundamental requirement for nanoparticle-based vaccine delivery to lymphoid organs. There are three main factors that we should consider. The first one is size. Okay. The nanoparticle size should be between 5 nanometer to 50 nanometer. It is very important. And why? Because this size range facilitates the targeting of lymph nodes. How? Because particles smaller than 5 nanometer tend to clear into the bloodstream. And also, if we have nanoparticles in the range, size range of 50 to 100 nanometer or more, they may become trapped at the injection site. So the best size range is 5 to 50 nanometer. And also, the other thing is that localization of follicular dendritic cells depends on particle size. With smaller nanoparticles being cleared quickly, while those in the size range of approximately 30 to 100 nanometer can exhibit prolonged retention in the follicular dendritic cells. So, if we have nanoparticles between 30 to 100 nanometer, we can increase their interaction with dendritic cells. So, we should know that this range of size is very important. And the second factor, which is very important, is material selection and modification. Okay, how it can affect, for example, assembly of saponin and toll-like receptor 4 agonist, monophosphoryl lipid A assembled with phospholipid, has shown to enhance the lymph flow and also increase the permeation of antigen into lymph nodes from the subcapsular sinus. So it has increased the early antigen uptake by cognate B cells. So if you know how to engineer your nanoparticles with, for example, here by saponin and TLR4 agonist monophosphoryl lipid A, you can have an increased lymph flow and also increased antigen uptake by cognate B cells. So this is very important. And also heavily glycosylated nanoparticles has shown to recognized by mannose binding receptor, and which activates the complement and complement mediated transport of follicular dendritic cells has happened. So this is very important. And the third one, which is very important, is the kinetics. We know that the prolonged exposure to antigens via repeated injections or implantable, for example, by using implantable osmotic pumps over several weeks, has shown to enhance T follicular helper and germinal center B cell responses in mice and non-human primates, and also increase the number of unique B cell clones, contributing to the germinal center response and enhances the induction of neutralizing antibody responses. How we can do it in our nanoparticle? Antigens can be engineered for tight binding to the adjuvants. This is the first method. And the second method, we can use this bioresorbable hydrogels to control the release rates of antigens and adjuvants over days to months, resulting in stronger germinal centers and significant increase in affinity maturation. And the third method is skin patches, like microneedles made from silk, fibrin, or other materials that can be used in order to release the vaccine or antigens over several weeks and enhance the germinal center and antibody. For more information, you can use this reference. that most of the the articles that we have talked has extracted from this reference, so you can use these reference and read this again for more information. Have a nice day. See you again.